You're going to be spearheading a program coming up on Tuesday at the Rustic Lodge. It's called Stop the Heartbreak in a Bottle. Tell us about that event.
Absolutely. So this is going to be on Tuesday, that's coming up November 13th at 6 p.m. at the Rustic Lodge. And this talk in this event is really to increase the awareness of the opioid epidemic that is affecting our community as well as many communities throughout the nation, and how this epidemic originated and how do we get to this point, and then also where do we go from here? How can we take a look at what is currently happening with the opioid crisis and turn into a positive and healthy situation for our patients and our community?
There are a lot of fingers that are pointed throughout this opioid crisis. Some point them at the medical community, some point them at the law enforcement community. It's easy to point a finger, but to find solutions and to find the way out of this is what the real challenge is all about, isn't it?
Absolutely. And using interventional procedures can play a large role in that process, as well as managing opioids the appropriate way based on the guidelines that the CDC has published, are ways and strategies that we can really begin to chip away at a crisis situation. And it's not going to change overnight, but education and information to the patients, the community, the physicians are all things that are very important to starting to bring back our way of having a healthy situation in the community with the opioids.
Okay. So at this event coming up on Tuesday, what are some of the highlights? What are some of the points that people will learn?
Sure. So we're going to have multiple speakers talk. We'll have the medical director of the IRMC emergency room speak at this event as well. We are going to have the district attorney there for Indiana County. There will be black boxes that the members of the community can come and dispose of any opioids that they may have from previous surgeries and safely dispose of them in the correct way. Additionally, I'll be speaking at this event, and my talk will gear on how the opioid crisis has become to where it is today, and also looking at what steps we can do to try to move past this opioid crisis.
All right. Take me inside that doctor-patient relationship. When a patient is in need of pain management, and opiates are one of the alternatives, but there are others. If you're the patient, how do you go about seeking every pain alternative that there might be so that you can make an informed choice?
Sure. I think, going to a pain specialist is part of that process. At a pain specialist, we'll be able to provide you with a thorough description of all the options available, using a multimodal treatment approach, meaning using multiple medications with different mechanisms that can all work synergistically to treat someone's pain, is one way to ensure that patients are on the lowest therapeutic dose possible of opioids. This not only will decrease opioids in the community, but also decrease the side effects for that individual patient. Using interventional procedures in the form of steroid injections as well as spinal cord stimulation are some things that we can do to complement a patient's treatment plan and provide them with the optimal relief of their pain while avoiding opioids.
Mm-hmm. Patients really do bear a bit of the responsibility, just as the physician does when it comes to managing that pain. If you're going to blindly accept, then you're going to be taking whatever is the first recommendation of that physician. But you should ask questions, shouldn't you?
Absolutely. And the physicians should have those answers for you when you do ask those questions. Mm-hmm. That you touched on the physician-patient relationship, and that is a very important part of the relationship in pain medicine. Having an opioid contract when opioids are appropriate, because there is a large portion of the population that do have real pain generators that are causing chronic pain every day. And to have opioids provided to those patients when appropriate is part of the process that a pain management doctor does and evaluates when those are appropriate situations.
When does a patient get in trouble when they're taking opioids? What is the step that leads them to the dangerous points?
Well, opioid medications have many significant side effects. Some of those include addiction, dependence, tolerance, withdrawal. These are all negative characteristics of opioids that can affect any patient. However, when taken appropriately, managed by a physician, these opioid medications can be used safely in the correct population. When a patient begins to use opioids other than prescribed, use them more than prescribed, or just does not securely lock them up in a safe, secure location and make sure that they know where their opioids are at all times, and not get exposed to someone else taking their opioids or their prescriptions. These are some of the pitfalls of opioids that ultimately has increased the epidemic in our communities.
Boy, you used two key phrases there, didn't you? Taken appropriately and managed by a physician. Those are the two key things right there.
That's true, yes. And always following the prescription is very important, and also following up with all of the requirements of the physician. And the physician can use the CDC guidelines that allow proper monitoring of patients on opioids. This can include pill counts and urine drug screens, and ensuring that the patient is using these medications appropriately and safely in our communities.
We're talking with Dr. Jonathan Scholl with the IRMC Center for Spine and Pain Management. He's the medical director there. Tell me about the center itself and how people end up there and what you're able to do for them.
Absolutely. So our center is located right outside of the IRMC hospital. It's in a separate building called the Human Motion Institute. There, you can get a referral from a primary care physician, or you can also come see us directly by calling our number at 724-357-8135. We'd be happy to see any patient that has chronic pain that would like to get an evaluation.
Mm-hmm. Spine and pain management. A lot of the pain that people go through have to do with those nerves in the spine, doesn't they?
Absolutely. We really specialize in neck pain and lower back pain, and that includes spinal stenosis, radiculopathy, which is nerve impingement and pain down your leg or your arm. There's many different interventional procedures we can do in the forms of epidural steroid injections, nerve blocks, spinal cord stimulation. These are all modalities to treat pain that we specialize at our pain center, and we'd be happy to provide that to our communities.
Yeah, wonderful. Wonderful. And again, give that number for the center itself.
Absolutely. Our number is 724-357-8135. And if you would like to RSVP for the Tuesday's event, please call 724-357-8088. There is a limited seating available, and this is a free seminar to educate ourselves about opioids in our community and what to do next.
Yeah, that's coming up on the 6th, or rather at 6 p.m. on Tuesday the 13th, this coming Tuesday at the Rustic Lodge. Talking with Dr. Jonathan Scholl. All right, we've been so darn serious since we started this conversation. Let's relax a little bit and learn about you. You're a local guy, huh? You're from Pittsburgh.
I am, yes. I grew up in Pittsburgh. I went to Carnegie Mellon for undergrad, University of Pittsburgh for medical school, went to Allegheny Health Network, got my residency in anesthesiology, and then a fellowship in pain medicine, and didn't go too far out here to Indiana to help serve our community.
Yeah, well, tell me about coming to Indiana. How was it that you hooked up with IRMC?
Well, I really looked on a national search when I was looking for jobs. I interviewed down in Charlotte, down in Texas, in Austin, Texas, Charleston, South Carolina. But something about Indiana really drove me to it. The opportunity to come in and really make a change in our community. There was a need for a pain management physician, and in order to step up to that plate and provide that to our community was really something that I was passionate about, to be a leader in our field, in our hospital system, and in our community. That
particular role and locations such as the Center for Spine and Pain Management, is that a common thing within the medical industry now?
I'm not sure what your question is.
Do you find a lot of pain management physicians? Is that something that most communities have now, pain management centers and specialists?
So as pain management is a subspecialty within anesthesiology, and really there's a shortage of pain management physicians nationally. So most communities do not have a pain specialist. We're lucky here in IRMC to have the opportunity to have the equipment, staff, the resources available to staff a pain and spine center. However, not every community has that, and many patients, especially in more central PA, more rural locations, may have to travel long distances to see their pain specialists.
Yeah, I was wondering because when the Center for Spine and Pain Management became a thing at IRMC, I thought, well, that's not something I've heard of, that whole concept of medical care. So it is relatively rare.
Absolutely, yes. And it takes further training from your residency in order to be have a specialty in pain medicine and spinal care. It is a rare occurrence. However, it's an important aspect to the care of a community, especially in the setting of a crisis of the opioid epidemic, as well as making a change in people's lives. Really, chronic pain is something that can affect someone's daily life. In order to have the opportunity to help them manage their pain and sometimes free them of their pain is a very rewarding process that I really am passionate about.
Is that what drew you to the field? Was that opportunity?
Absolutely. I think chronic pain is when you deal with a patient population that really needs the most help. They've been dealing with pain for so long, and in order to offer them a solution that they might not have known before, that is effective at managing their pain, getting their daily functioning back, and improving their life is something that is beyond rewarding and something I'm lucky enough to do every day.
Wonderful. Hey, good to meet you. I'm glad you came in to tell us about this event coming up. Again, it's Tuesday at the Rustic Lodge, 6 p.m. You can call 357-8088. Remember, it's free, but there are a limited number of seats available. And the prescription drug take-back, that's a very, very important thing. Appreciate your time here this morning. I know you're a busy guy.
Absolutely. Well, thank you so much for having me.
Our pleasure. It is Indiana in the Morning, presented by First Commonwealth Bank, WCCS.
Hello.